Do you believe it? It's the last chapter of the book, and you've gotten so far through the book. The Future of Health Services Delivery by Professor Tammy.
The Future of Health Services Delivery, Part 2. Global Challenges. The CDC is actively involved in global surveillance and early detection of health threats. Over 60 global disease detection centers. So I just want to explain what surveys are. Surveys are like a one-time thing. You kind of say, hey, can you fill out these questions? And can you give me an answer? These are surveys. Surveillances are continuous. Surveys are just like kind of one time, and surveillance are continuous. Like you keep kind of looking and studying, and sometimes asking. International cooperation is an ongoing challenge. International health regulations are binding on 194 countries, aimed at preventing and responding to acute public health risks that can threaten people in other countries. But 80% of the countries have failed to report disease outbreaks and other public health events. No international agency has the authority to enforce compliance. Armed conflicts affect medical care and public health services. Diseases such as diarrheal episodes and acute respiratory infections spread in war zones. Healthcare infrastructure sustain damage. Health workers cannot carry out their jobs. Supply dwindle. Refugee migration strain food and water supplies and sanitation. Global unrest can bring bioterrorism to the United States. New frontiers in clinical technology. Genetic mapping, personalized medicine and pharmacology, genomics that deals with genes and pharmaceutical stuff, drug design and delivery, image technologies, minimally invasive surgery, vaccines, blood substitutes, xenotransplantation, regenerative medicine. Care delivery of the future, advancements in imaging, molecular medicine, and distant monitoring. Shifts from a focus on acute care to prevention and aftercare. Patient risk profile based on lifestyle, family history, and genetic factors. Regular screenings for high-risk patients. Use of image-guided minimal invasive surgery. Like some surgeries used to be more invasive, like for C-section, they were like cut in the middle. Now it's like a little bikini cut that you can barely see. So we've gotten better with surgeries and technology too. Individualized pharmaceutical treatment. Implanted devices to take over damaged body functions. And regenerative medicine to help heal damaged tissues. Conclusion. The future will be determined by how certain forces of change interact. Serious issues remain with the ACA and the areas of coverage, cost, access, and affordability. Rising healthcare costs and low growth economy pose serious challenges. The existing model of healthcare delivery must also change. New models are being investigated.
See you soon, and remember to read the book.